The Supreme Court overturned the landmark Roe v. Wade case just a few weeks ago.
But Texas, like many other states, has a trigger law in effect. To tell us more about what that means and how this will affect Texans, we're joined by Fox 44's Allison Fox O'Connor. Allison, what'd you find out?
Well, Adam, I spoke with two local attorneys to find out how this will affect Texans after this weekend when the trigger law is going to go into effect.
Now that Roe v. Wade has been overturned, when the 30 days have elapsed this weekend, those laws are immediately going to take effect.
The law attorney Kristen Kay is referring to is House Bill 1280 that was originally passed in 1925 but was not enforced when Roe v. Wade went into effect in 1973. The landmark Supreme Court case was overturned on June 24th this year, and Texas's trigger law states that the old law would take effect 30 days after the overturnment. So what does that mean for Texans?
This law, specifically House Bill number 1280, has put into effect criminal punishment. So there's some civil punishments and criminal punishments for someone who is supporting or giving an abortion. So these laws are actually targeting the medical professionals, not necessarily, or criminalizing for them, not necessarily a patient or an individual.
Attorney Brandon Luce says that House Bill 1280 will make assisting or giving an abortion a second-degree felony, and if the unborn child dies, the charge is raised to a first-degree felony. Another side effect of overturning Roe v. Wade is that many medical professionals are leery of prescribing methotrexate. It's a drug that is used to terminate an ectopic pregnancy, but that's not the only use for this medication. AP News reported that, quote, the Arthritis Foundation and American College of Rheumatology have both issued statements of concern about patients' access to the drug. Stephen Schultz of the Arthritis Foundation said the group is working to determine how widespread the problem is. Other uses for methotrexate include treatment for lupus, cancer, and psoriasis. In the meantime, people who have those conditions are having trouble getting their medication. So whether the drug is used for termination or the wide array of other conditions, there's still plenty of confusion with the gray area of the new laws.
These laws they're general, and they haven't been litigated. I have recently seen some cases where, a mother was suffering from an ectopic pregnancy and the doctors knew that she needed intervention, but they weren't sure when they were allowed to intervene. Do we have to wait until she's about to die?
Now, there is still a lot of gray area surrounding doctors' decisions, but House Bill 1280 is still set to go into effect this weekend. In the studio, I'm Allison Fox O'Connor, Fox 44 News.